Well, good morning to each of you. A Happy New Year to each of you. Thanks to each of you for being here early in the new year and for all that you're doing in our national efforts to improve the focus and effectiveness of our engagement of high-need patients. Clearly, the healthcare system as a whole in our nation still suffers from fragmentation of a substantial variety, although each of the folks in this room are working hard to ameliorate those conditions, drawing from the policy license that are embedded in the ACA and other legislation. Still, the results of that fragmentation fall most hard on those who are most vulnerable in our population, those with multiple complicated needs, and the consequences for the nation are substantial. We have the opportunity through the work that you and your colleagues are leading around the nation, not only to improve the circumstances for those patients, but also by virtue of effective engagement of their problems to improve the overall operation of the healthcare delivery system. And that's the purpose of this series of 3 meetings, of which this is the second, which are focused on improving the care for high-need patients. The initiative is a unique collaboration across several organizations. We in the National Academy of Medicine are very pleased to be part of that collaborative activity, which is sponsored by the Peterson Center for Healthcare. Jeff Selberg and his colleagues are great partners in this effort. We have also, as part of the partnership, the Bipartisan Policy Center, and Catherine Hayes, who is on her way, and her colleagues are part of that effort. The Harvard School of Public Health is part of the partnership in that respect. Ashish John colleagues are with us. And then there are obviously other organizations with which we work in association. The Hartford Foundation, Terry Fulmer and colleagues are here. The SCAN Foundation, Bruce Chernoff and colleagues, and many others in the room. So again, thanks to each of you for the commitment, leadership, and engagement with us in this work. Special thanks as well to our patients who will be introduced later on, who've joined us. They represent obviously our primary focus and interest, and although they're few in number at this particular meeting, we have formed a patient and family leadership network which is engaging with us as well to extend the reach in this respect. This is the second workshop, as I noted, of 3. The first workshop last summer, we worked to establish a common understanding of the high-need patient population, their unique characteristics and needs, and the challenges and opportunities for various models of care. In this particular workshop, we have 3 objectives on data and segmentation, on design elements, and on the policy implications, aim to review the existing data sources on care delivery to high-need patients, consider how the population may best be characterized to design and target care more effectively, to explore successes and lessons learned from designing various models of care, and to begin considering policies that are particularly important to spreading the most successful models. And I underscore in that respect an issue that I know Jeff Selberg will underscore as well, and that is the commitment of the Peterson Center for Healthcare and the Peterson Foundation to enhancing the spread of proven models. Building on the foundation of the earlier meeting, we've convened a smaller group, you folks, which is more targeted, and with a presumably stronger focus on rolling up the sleeves and getting a work product that can help us move to the informed deliberation later of the policy implications. I'd like to begin as well with thanks to the Planning Committee, the chair of which is Peter Long to my left here from the Blue Shield of California Foundation. Peter has just been a superb chair, and he has had a superb group with which to work in advancing the elements of the agenda. Melinda Abrams of the Commonwealth Fund, Jerry Anderson of Johns Hopkins Bloomberg School of Public Health, Tim Engelhardt from CMS, Catherine Hayes from the Bipartisan Policy Center, Parna Higgins from America's Health Insurance Plans, Frederick Isasi from the National Governors Association, Ashish Jha mentioned earlier, David Myers from the Agency for Healthcare Research and Quality, and Arnie Milstein from Stanford University. Before turning the microphone over to Peter, over to Jeff, who will offer welcoming remarks on behalf of the sponsor, I'd like to also give particular thanks to Katie Lewis-Apton, who has been the staff person coordinating this meeting, as well as to the folks on our staff with whom she's been working. Carrie Wolf, I think, is back there at the control center. Minna Bakhter, and Roisin Birdie, who are also there. Actually, I should probably also draw, before turning this over to Jeff, your attention to what's in the green folders here. On the left-hand side is the agenda, followed by a brief description of the Value Incentives and Systems Innovation Collaborative, which is the umbrella group within which the work, at least the National Academy of Medicine's component of the work is stewarded, and which is part of our broader leadership consortium on value and science-driven healthcare. Behind that are some other elements related to the work of the consortium and the National Academy of Medicine, in particular work around vital signs, the core measures for better health and healthcare throughout the nation, which is one of our flagship efforts aimed at sharpening our focus on what's possible and improving the efficiency of measurement. You also see on the left-hand side the workshop participants and the Planning Committee. On the right-hand side, you'll see the description of the overall project, Models of Care for High-Need Patients, a summary of the discussions in the first workshop, a description of the breakout sessions that we're going to be having, and the assignments involved in those breakout sessions, and then the various biographies for folks who are here. Again, thank you very much, and Jeff, thank you. Yep.